So good afternoon to all of you. We will be waiting for the speaker to join, and then we will start our 46th SOAFAL oration. So kindly have patience. Once the speaker joins, then we can start the program. So the speaker is actually trying to join, but there is some connectivity issue at her end. So kindly have patience. Once he is connected, we will start the program.
Good afternoon. Am I audible?
Yes, yes. Good afternoon, madam. Good afternoon.
Good afternoon.
Good afternoon. Okay. So today's speaker has already joined. So good afternoon to all of you. Good afternoon to our Pro-Chancellor, Professor Amit Banerjee, and all the audience present in this prestigious 46th SOAFAL oration. We are very fortunate to have amongst us one of the most distinguished doctor and administrator the presently Vice Chancellor of the West Bengal University of Health Sciences, Kolkata, Professor Dr. Suharita Pal. Welcome, Madam. Welcome to this audience.
Thank you, sir.
Uh,
I'm honored.
I have the privilege of welcoming today's speaker to the audience. Before that, let me just tell you briefly about the genesis of this program. This SOAFAL oration actually started since February 20th, 2021, and since then we have already completed 45 SOAFAL orations uninterruptedly. And after the finishing or completion of 25 SOAFAL orations, we have brought out a book called SOAFAL Mala, Volume 1, which was inaugurated by the founder president of our university, Professor Manoj Ranjan Naik, in 15th August 2022. So this is the 46th SOAFAL oration. Once the Golden Jubilee SOAFAL oration will be completed, we will be bringing out the volume 2 of the SOAFAL Mala. And today's topic is a very, very interesting and very important for our young students and young faculties, the importance of mental health in a multicultural university ecosystem. As all of you know, this university houses international students from more than 30 different countries, and basically students belonging to almost all countries of Africa. So now, without much ado, let me introduce today's speaker to all of you. Professor Dr. Suharita Pal did her MBBS from Medical College, Kolkata in 1991 and MD Pharmacology from Calcutta University in 1998. Presently, she is the Vice Chancellor of the West Bengal University of Health Sciences, Kolkata, West Bengal, India since August 2021. Previously, she was the Professor and Head of Pharmacology, Medical College, Kolkata from 2011 to 2016. Medical Superintendent and Vice Principal, Murshidabad Medical College, West Bengal from 2016 to 2018. And Principal of Burdwan Medical College, West Bengal from 2018 to 21. She has more than 26 years of experience of teaching both at undergraduate and postgraduate students, UG/PG examiner of many universities of India, remained co-guide of MD and PhD students since 2008, more than 28 years of experience in preclinical and clinical research, more than 70 publications in various national and international index journals, and reviewer of various national and international journals. Her other involvements include member of a Medical Advisory Council of National Medical Commission, West Bengal Medical Council, Indian Society for Rational Pharmacotherapeutics, International Journal of Drug Formulation and Research, governing body Dr. B.C. Roy College of Pharmacy and Allied Health Sciences, Durgapur, expert committee for remodeling of the West Bengal Medical Education Services, life member of Indian Pharmacological Society and advisor, IPS West Bengal branch, Indian Medical Association, acted as organizing secretary, organizing chair, guest faculty chairperson in a number of national and international conferences, scientific seminars and workshops organized by Government of West Bengal and national and state academic bodies, acted as resource person in various CME on medical education organized by Institute of Health and Family Welfare West Bengal, chairperson of Institutional Ethics Committee for Human Research, Burdwan University since 2018, Institutional Ethics Committee for Human Research, Rampurhat Government Medical College since 2019, Institutional Ethics Committee for Human Research, Institute of Postgraduate Ayurvedic Education and Research since 2015, nominated by CPCSEA, Ministry of Environment and Forest, Government of India, as member chairperson of Institutional Animal Ethics Committee in various institutes all over West Bengal. Once again, I welcome you, madam, to this August gathering. And before the platform belongs to you, I will request our Chancellor, Professor Amit Banerjee, to kindly say a few words, sir. Sir, please unmute yourself. सर अनम्यूट कीजिए. नो अभी 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 तो बोलिए. नहीं, आपका वॉइस नहीं आ रहा है. Somehow your voice is not audible to us. Your voice. Your voice is not audible to us, sir. Okay, then I think we will proceed with Madam's oration. There is some connectivity problem at SAR's end. So, Madam, please.
Thank you so much, sir. I'm really honored that you have invited me to speak on a topic which is very close to my heart. I started my journey regarding this mental health awareness initiative from the angle of a mother. Because when I was principal in Burdwan Medical College, we had at least 3 such deaths which were unnatural, fall from 8th floor and the boy dies and things like that, and the chain of the series of events that occurred thereafter. So when I assumed the charges as the vice chancellor of this university, the first thing that came to my mind that mental health awareness is much needed, and being in the midst of a university with 262 institutions, I have the opportunity to at least try to generate this awareness initiative amongst the university students, its faculties, and maybe in the long run amongst the population as a whole. So when I was just talking about this effort of ours, Professor Banerjee, he told me that, okay, this seems to be so interesting, and definitely you are August gathering. So if I get an opportunity to speak in front of you, maybe I shall be able to percolate further the feeling. Mostly I'll be speaking from my heart because I did some bit of reading regarding this topic when I was asked to speak to you knowledgeable persons. But I started my journey from the very core of my heart as a mother. And finally, what I realized that you don't need to do lots of reading to do some good work. What you need is the intuition and the zeal and the prioritization that what you have to take up in the right time. So I'll just start my talk. The topic that was given to me was the importance of mental health in multicultural university ecosystem. So the topic first seemed to me a little complicated or a little more challenging. But what I then realized is that this is perhaps the most appropriate topic that could have been given to me. The person who has decided on the topic is definitely a very learned person and has realized the importance of this topic. Before we start off, why are we superior most creature on this earth? Because we have a mind. And we really don't know if animals, they have a mind or they can speak their mind out. But we have a very complex mind. And as the body suffers from illness, so does our mind. So definitely we must be fit mentally and physically to lead a happy, healthy and productive life. And we have been reading the definition of WHO where it says that health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. So we can well assume that mental health also has been given prime importance in case of a happiness or a health, overall the holistic approach to health. Because poor mental health will definitely be associated with certain determinants such as the rapid social change, stressful work conditions, gender discrimination, social exclusion, unhealthy lifestyle, risks of violence, physical ill health, and also human rights violations. This is what WHO has said. If we just have a quick look at the global burden of mental illness, in 2019, there were almost 970 million people worldwide with some sort of mental illness, with anxiety and depressive disorders being the most prevalent. This is almost 15% of all the recognized diseases worldwide. And then in 2020 came the COVID-19 pandemic, that indicates a 26 to 28% increase in anxiety and major depressive disorders in just 1 year. And when you look at the disability adjusted life year loss due to neuropsychiatric disorder, it is much higher than diarrhea, malaria, worm infestations, and tuberculosis if they're all taken individually or even together. And depression is one of the major reasons for disability. When you don't want to do something, you're not feeling good, you don't have the zeal to work, and that leads to disability. The burden of mental disorders is quite high because it has been seen that life expectancy in people with serious mental illness is diminished by almost 2 decades compared to death due to treatable physical ailments. And suicide ranks the 4th most common cause of death amongst the age group of 15 to 29, the age when they are the youth and they are the most productive age group, and they are mostly in our university age group. Poor awareness about the symptoms of mental illness, the myth and stigma related to it, lack of knowledge, lack of access on the treatment availability, and the potential benefits of seeking treatment is not known. So these are the important causes for prevention and high treatment gap on mental disorders. And also human rights violation, prejudice, and stigma contribute to this scenario. If we look at the history of mental health, the history of mental health is as old as the history of mankind and also the history of physical ailments. In ancient Egyptian, Indian, Greek, and Roman writings, mental illness was categorized as a form of religious punishment, demonic possession, or personal problem. Even today, you will find in many rural areas, a person with mental illness is often treated as some demonic possession, going to Ojha for Jharfuk and things like that, which really has got no rationale. First, in the 5th century BC, Hippocrates realized that mental illness is also some sort of illness, and he focused on changing the environment of the patient or occupation of the patient, or administered certain substances as medications for the treatment of this mental illness. But the negative attitude towards mental illness persisted till the 18th century, leading to stigmatization, unhygienic, degraded confinement of the mentally ill individuals. Modern psychiatry in Indian subcontinent dates back to the 17th century, and the first asylum was established in Bombay in 1745 and the second at Kolkata in 1784. But both were only for the Europeans. The Indians did not have any opportunity to avail this service. There are a number of engravings, and if you look at history, there is also history of trephination or boring of the skull, making hole in the skull to create cure mental disorders. So it has been from time immemorial that mental disorders were there, and there were some attempts to cure, but mostly the stigma and the looking down upon these people and degrading them was the primary concern. Even in Ayurveda, body and mind comes together. The Ayurveda, the oldest medication system at least in India, 3,500 years old, has very rationally stated that demarcation between body and mind is not to be done. A patient is treated as a holistic, in a whole, in context to the external environment. This integrative approach of body and mind being treated together reduces the distress of body and mind and results in holistic wellness of a person. Even in recent research in psychosomatic medicine and psychoneuroimmunology, It has been seen that working with a composite of body and mind is more effective than reductive or dualistic approach. If a person is having some illness, you are just treating the symptoms without going into the depth of it. That is not what is warranted. In Ayurveda, therefore, mental health is perceived to be a product of one's karma or actions, vayu or air, which is perhaps the environment, and swabhav or one's own nature. Later on, in 1982, we have the National Mental Health Program in India, which ensures the availability and accessibility of minimum mental health care for all, particularly to the most vulnerable and underprivileged section of the population, to encourage the application of mental health knowledge in general healthcare and social development, and also to promote community participation in mental health service development and to stimulate efforts towards self-help in the community. Then came the District Mental Health Program, which was launched under the National Mental Health Program in 1996. This was separate for each district. They have their own agenda and they are supposed to work on early detection and treatment of mental illness, impart short-term training to general physicians for diagnosis and treatment of common mental illness with a limited number of drugs under guidance of a specialist. Health workers are being trained in identifying mentally ill persons. Like the ASHA workers, the A&M workers were going and working in the household of the population. They should be also trained to a certain extent so that they can be able to identify the mental illness or if there is some mental issues which needs to be addressed. Definitely public awareness generation by IEC is very, very important, and monitoring is also equally important to have success in any program. So why is mental health so important? Because in every stage of life, childhood, adolescence, or be it adulthood, we have some time or the other faced certain scenario or certain situations which we are not happy about. But this mental health refers to emotions and how we approach to difficult or different situations in life. It affects how we think, feel, act, and how we handle our stress, relate to others, and make healthy choices. It also impacts how we socialize and our motivation to academics and how much we are into academics. With good mental health, we are able to approach challenges, minimize stress, and overcome any obstacle that might come our way. There are various factors that affect mental health. That could be one's genetics, family history, experiences, maybe some traumatic event in childhood that has led to that has affected the mental health and led to some sort of disorder in adulthood. Maybe the environment and so many other factors. Regardless of whatever the current state of one's mental health is, we must all be careful and give some effort or practice some simple things to control ourselves, control our mind, and improve the mental health. Even in WHO in recent years has noted that there is inclusion of mental health in sustainable development goals, which is indicative of the rising awareness of the critical role of mental health in any development. But mental health, it is still a taboo, though it is a raging issue in today's times, and at some point of a time, almost all of us experience fluctuations in the condition of our mental health, in our mood, but we are yet to accept when things are beyond the acceptable limits. There was a period when people visiting psychiatrists were understood or called mad or crazy people and refer to a few clearly abnormal patterns of behavior and experience. But in recent decades, the actual objective of psychiatric profession has shifted significantly and a spectrum of mental diseases have evolved or mental health problems which includes a number of conditions that are on a scale from normal to abnormal. This is very, very important because any person who is seeking some sort of help primarily is considered to be pagal hai or mad, which is not at all acceptable. We freely talk about mental health issues. We indulge in criticizing or analyzing people who are going through psychological problems only when it is happening to someone who is not emotionally or socially significant to us. But trust me, when it is a very near and dear one of ours, maybe unstable daughter or a suicidal friend or a spouse, do we really debate over this situation? There is still stigma and taboo associated with mental illness, irrespective of the socio-economic, cultural, religious, and ideological boundaries. This mental mindset needs to change right away. Mental illness is not madness. Mad and crazy are very derogatory terms, and we must refrain from using such terms. The correct term is mental illness, not madness. So the mental health stigma is something like that. If a person is having some sort of mental illness, maybe a lady, she's advised, you shouldn't have kids, you just pass on your issues. So selfish of you. Imagine. Some people even find it funny to say that all women are a bit bipolar, or mental illness is just an excuse to shun off your responsibilities and not contribute to the society. Some say kids and teens cannot have mental illness. What have they got to worry about in life? Therapy and medications are just scams. You just don't need all of that. One who has nothing to do in life feels depressed, and it is his liberty or it is the luxury to go and seek help. Is this the real scenario? No, this is the stigma I'm talking about. Stigma around depression and mental health illness is higher in some cultural groups, a major barrier from people from diverse cultures when accessing the mental health services. Especially in the low and medium income countries like India, these issues become even more significant because the family is often the only safety net the individuals have, and the government safety nets are minimal or do not exist. So support from the family is very much warranted, but lack of support due to perceptions of stigma can lead to a neglect of a person with mental health issues. So positive mental health, just to summarize, positive mental health will allow us to realize full potential of life, cope with the stressful situations, work productively, and make meaningful contributions to the community. And how can we maintain positive mental health? Get professional help if we need it, connecting and helping others, staying positive and being physically active, getting enough sleep, and developing coping skills. The importance of mental health in the youth. Why now we come to the university students, the youth. Mental health must be of primary concern for them because the youth of a country determines the future of a nation. The youth has the power to help a country develop and move towards progress, responsible for bringing social reform within a country. A strong body and mind can only shape individual and collective future of nation. It is only when the mind is very calm and collected that the whole of its energy is spent in doing good work. As Swami Vivekananda stated, Supreme value of youth period is incalculable and indescribable. Youth life is the most precious and best time. The way in which they utilize this period will decide the nature of the coming years that lies ahead of the youth and also the nation. So we need to prioritize mental health in colleges and universities, as college life sets a foundation for the rest of the life with experiences gained during college days that are once in a lifetime. Mental health in college will have an impact of overall health, college experience, and also academic outcomes. Additionally, the colleges also must have a support network for mental health through student services, mental health counseling, mentors, parents, peers, professors, and others willing to help you. And sometimes the students, they have so much to say, they have so much to grievances, they are not happy with their environment or the scenario. But as Swamiji stated, it is very easy to point out defects of institutions. All are more or less imperfect, but he is the real benefactor of humanity who helps the individual to overcome the imperfections under whatever situation or in whatever institution. Mental health in university students, if we have a look at it, according to the National Alliance of Mental Illness, over 75% of mental health issues start before the age of 24. A significant number of students with emotional problems are enrolled in the university, sometimes with a formal diagnosis or maybe some informal disabilities. It has been seen that prevalence among the female students in the first year of the university program is higher than their male counterpart, with problems such as depression, anxiety, suicidal thoughts, psychosis, addictions, use of psychiatric medications, or other chronic psychiatric disorders. They are more at risk of negative mental health because they're exposed to two sources of transitional stressors: stress related to the transition from high school to university student status, and also the stress related to the transition from adolescence to adulthood.
Hello.
The university ecosystem, if you look at it, it is a multicultural ecosystem. First of all, we must consider that India is the second most populous country in the world with widest cultural diversity in terms of caste, religion, food, language, racism, etc. Therefore, Indian universities will also likewise have a multicultural ecosystem where students from different countries and different Indian states will also come under one umbrella for higher education. So the students will have diverse culture as they come from different countries, different states, with different races, color of skin, language bar, food habits, social customs, difference in festivals, etc. And as we know that the students are admitted in the colleges through different quotas. It could be the government quota, the state or all India basis. It could be management quota. It could be NRI quota or even the foreign national quota. So many, they are divided at the very outset when they enter university. They have a stamp of being of one particular group. In addition to that, reservation due to caste or economic condition like SC, ST, OBC, physically challenged, or even the EWS quota, also it gives a challenge. They have difference in religions and beliefs, and also some sort of gender discrimination can also not be neglected or ignored. So this cultural diversity has a great impact on their mental health because there are issues of racism and discrimination, and that leads to difference in the ways in which health and illness is perceived. Because still, as on date till now, Some cultures relate onset of mental illness to the possession of spirits, evil eye, black magic, or bad luck. And they go and seek help from the traditional healers, maybe astrologers, religious leaders, temples, mosques, and etc. So, the attitude of the consumer in seeking treatment available in the mental health care system is not appropriate or not adequate. So, and also the mental health professionals, they work with clients from different culture that also influences their relationship with their patients when they deal with them. These diverse cultures also has some sort of implications for the mental health professionals because some cultures may identify lack of balance in expression and reluctance to utilize talking therapy that may lead to disease. So, when there is some sort of counseling, when a person has to open up or talk, there is lack of this expression, lack of the capacity to express what he is having in his mind or what he is feeling inside. So, that makes the talking therapy difficult. Sometimes they are suffering from some sort of stigma or shame. They want to protect the family reputation and their own dignity, as seeking help from mental health professional would see them as crazy. There is collectivism. It is impact as a supportive factor to resilience and coping. Even if a person feels that he needs to seek mental support for his mental health issues, maybe the other family members are not agreeing to it. If a girl is thinking like that, maybe the parents would think that if people come to know, it will be difficult to give her hand in marriage. So these are certain issues. The family members also, they keep on giving their opinion before a person can seek help when the person is really in need. Spirituality and religion also helps in coping with our mental health issues, but sometimes does the opposite because denial from the available therapy or available treatment worsens the condition. Particularly if we have a look at the medical students also experience mental health issues like eating disorders, anxiety, depression, and substance dependence. The illness is invisible character, less observable than a broken limb or a respiratory infection. So people mostly, what the most important problem is that they suffer from denial. And also there is certain amount of dread associated with various mental illnesses such as schizophrenia. And although schools are required to offer support to students with these disorders, stigma, fear, and ignorance frequently discourages students from coming forward to seek assistance. They are in the fear of being projected as weak and vulnerable. That is the major reason why they don't want to talk about their mental health issues. We were talking about the female who are suffering more and they seek help, but it is evident that the men are less willing to seek help when they are having some sort of problem because they are under pressure to uphold the ideal of strong masculinity, and as a result, illness is viewed as a weakness that will be utilized to discriminate against them. According to the National Institute of Mental Health's most recent data, 14% of Indian males are thought to be mentally ill, of which 10% struggle with depression, anxiety, or substance abuse. According to the survey, despite of being ill for more than a year, only 20% seeked some sort of help and 80% did not receive any treatment due to the stigma associated with mental disorders. The most prevalent mental disorders among university students, as it is observed, is depression. It has been seen in several countries like Spain, England, Australia, and United States. First year female students are suffering the most, more than their male counterparts, and they seek help more than their male counterparts. Depressive symptoms lead to poorer academic performances, their increased vulnerability for experiencing additional mental health problems, including anxiety, intrusive thoughts, and sleep disturbances. Depression leads to anxiety. According to the Anxiety and Depression Association of America, anxiety disorders is widely prevalent among the college students and it is the most common type of mental health issue. The rate of anxiety disorders is double in females than their male friends. The major cause is associated with the condensed academic courses, academic failures, and emotional factors. This anxiety can lead to suicidal ideation, substance abuse, physical illness, risky sexual behavior, and also has a negative impact on the cognitive and learning abilities among the university students. The third and the most prevalent, most important issue is stress. Because the students are at undue stress because they have to deal with a vast range of different academic, social, and personal challenges. Stress occurs when an individual perceives that environment demands or tasks exceeds his adaptive capacity. The major factors associated with perceived stress were long hours of study, examinations, very tight time schedules, psychological and family issues, lack of entertainment in the campus, lack of facilities for sports, and in the education system itself. These continuing stressors have negative influence on both the physical and mental health, which exhausts individuals' energy and may lead to less functional productivity. So, integrating the stress management skills into university curricula will be helpful in reducing the prevalence of this problem and other mental health disorders related to stress. So, if you want to just reiterate or maybe reinforce the academic pressure, the financial burden of the student with the increase in tuition fees, decreased financial support from the government, maybe some are studying with students' loan with high interest rates, could add to their stress, depression, and anxiety. The negative effect or overuse of technology is also another very important issue, which includes internet addiction, mobile phone use, or overuse of internet pornography that leads to depression, anxiety, social isolations, shyness, low self-esteem, and lack of social and emotional skills. Change in the lifestyle of student also is a major contributor because often when they come to the hostel, they are not happy with the food they get. They're getting sometimes unhealthy or poor diet. There is lack of physical exercise, inadequate coping mechanism that results in stress, depression, and anxiety. The influence of transition experience is something which I would like to share with you. It has been observed that the first year university students, they are coming from different backgrounds. They experience increasing level of stress that negatively influences their mental and psychological well-being. The factors could be like moving into unknown environments, first time they're away from their home into some unknown place, isolative nature of the university environment away from their family and friends. They have to be self-sufficient, function independently. They have to cope up with the situation, but they lack these coping abilities. Lack of autonomy when compared to students in the senior years of subsequent years of study. Increase in stressful events like not passing an exam, or maybe the financial problems, cost of books and other course materials, etc. The most common stressor is the time span allotted for sleep, because it has been observed that time allotted for sleep is very limited and it's the most significant predictor for depression among university students. Chronic poor quality and quantity of sleep leads to development of mental health issues like increased agitation, depressive symptoms, fatigue, and this negatively affects their ability to function academically and socially. They become addicted to alcohol, tobacco, stimulants, and other non-prescription drugs to help improve their fractured sleep patterns and fatigue, and cope with their boredom, lack of interest in life, and perform academically better. This in turn leads to increase in suicidal thoughts and behaviors, depressive symptoms, anger, and fatigue. So they fall into the vicious cycle. Now, what is the role of the academic institutions then? The role of the academic institutions is to facilitate a supportive environment that will nurture the student and help them grow. The academic institutions must try to promote mental health awareness and form student support groups, provide specific interventions that can help students in coping with stressors and promote mental well-being, like academic supports for students with mental illness that shows to improve resilience for students, develop academic skills, and improve socialization capacities, accommodation for students with mental health concerns in order to help them ensure better academic outcomes, and appropriate trained staff and counselors to provide emotional and psychological support during the time of mental distress. Educational programs also can be designed to identify concern in the early stages of mental illness and assist the students with potential harmful behaviors, including suicide. It is very important that we talk about mental health. Mental health issues can occur to anyone. It is very helpful to talk about these issues with others if felt. Parents and caregivers must get tips for starting the conversation about mental health problems. Friends and family members must support people with mental health issues that hastens and makes all the difference in the person's recovery process. Educators should be able to notice the mental health problems at the very outset. It is very important to identify them and develop effective strategies to meet the mental health need of the students. Faith and community leaders also must learn how to support mental health in community, as many people facing such issues or going through traumatic events go to them before they turn to a healthcare professional. How to seek help? The best way is to share problem with someone whom we can trust, or we know that will care, be non-judgmental, helpful, and not make fun of me or disregard me if I'm in problem. Just talking and sharing can work wonders. There are a number of helplines that operate across the world, run by various NGOs and institutions, that specifically deals with the mentally troubled people, and they're very helpful and they're easily available on the internet. If we are not willing to talk at all, even writing to the particular NGOs will help, as they get back to you as soon as possible. So it is very important to seek help and not to sit on it. The last, or the next step rather I should say, is to seek help from a psychiatrist or a clinical psychologist who are experts in their domain and will help in the most appropriate manner. It is again very, very important to avoid looking up the internet for symptoms and diagnosis. This is important not only for mental health but also for physical ailments. Nowadays, Google is the most experienced doctor on earth, and sometimes more than the clinician who is treating us, we trust Google or we trust the net with our diagnosis and treatment. Most of the times, but they are misleading, overgeneralized, and inaccurate. So it is better to surrender to a qualified practitioner, trust him, and let him take charge from there onwards. To increase the young people's comprehension of the variety of mental health issues, public education also is very, very important, and the symptomatic vignettes for psychiatric terminology should be changed. Use accessible language and imagery so that they can well comprehend. It is advised to use educational institution-based awareness program and content, which is pertinent to culture and age-appropriate social roles to eliminate the public stigma. Now, I have come to the last part of my oration where I want to share the mental health awareness initiative of our university, the West Bengal University of Health Sciences. There was launch of the Mental Health Awareness Initiative program by the university on 1st January 2022. A robust committee was formed to initiate this mental health awareness drive, and all HODs of psychiatry departments and senior administrators with Vice Chancellor as chair was formed. The committee sat a number of times and a modus operandi was framed. First thing what was done was that an online survey was conducted by sending Google Forms to all medical, paramedical, nursing, and Ayush colleges under the aegis of WBUHS through email. We received almost 6,000 responses, and the index survey showed a high prevalence of depressive symptoms among students and a significant proportion of them having suicidal behavior. There were multiple sources of stressor, particularly financial constraint in the family, pressure of examinations, burden of study, staying away from home, quality of food, and language difficulty were identified. Till now, what I have been talking about was what I got through my reading, through reading the review articles, and when it comes to the initiative of the university and when we did the survey, it absolutely corroborates with what is already prevalent across. So we can well assume that our population is also similar to other universities, maybe other populations across the world. Then we thought of creating mental health awareness among the potential stakeholders like parents, teachers, hostel wardens, security personnel, non-teaching staff regarding mental health issues and emotional problems, because it was perhaps it is the only way forward to tackle this challenge. Videos were uploaded in the YouTube channel of the university regarding mental health issues to generate awareness, the need to identify students who were suffering from mental health problems or at potential risk of mental health problems were identified and referred to the professionals for help and support. A number of helpline numbers have been given in the university website. Also, a dedicated helpline number and telecounseling facility has been started at the Institute of Psychiatry, Kolkata, which is an affiliated institution of the university, and also in different medical colleges across the state under the aegis of the Department of Health and Family Welfare and the university. Gatekeeper training for suicide prevention amongst all the stakeholders have been held and are being held as a step towards suicide prevention. Almost more than 110 such training sessions have been taken in the past 7-8 months. Mental health advisory and guideline for mental mentorship program has been sent to all affiliated institutions, which shall help in prevention of mental health issues amongst our students. Coming to the mentorship program, I will not go into the details, just a few words that it is a formal framework of mentoring program, a structured one where one-to-one relationship in an academic setting. It will allow the people or the students to learn from one another, providing a path to skill and knowledge transfer, gain shared experience and thereby contributing to experimental learning. It is an essential component for successful career and it will bridge the gap between the faculty and students. We have had mentors and mentees. Each mentor or faculty will look after 7 to 10 students, and we have also given the do's and don'ts of mentorship program for the guideline for the mentors and the mentees, so that it is a very sensitive issue and we don't want that one's invasion of privacy should be there in conducting such programs. Efficient and successful mentoring program will definitely provide students with the necessary emotional and instrumental support, optimal guidance, sufficient encouragement, better environment in college, and motivate them to do and live better. So the benefits of this mentoring program will be improved personal and career development, directions to career planning or progression, improved productivity or learning skills along with learning leadership, analytical or decision-making skills, learning the cultural support system, reinforcement of knowledge since they will discuss among themselves and it is the best way to learn is to teach, expansion of skill sets, meeting faculties and colleagues from different departments, improving the listening and interpersonal skills and thus build confidence. So it is very important that we open our minds to the possibilities of mental illness and seek help for self and for others if needed. We must deal with mental health issues without inhibition or hesitation, just like we would deal with any common physical ailment. I have been telling my students whenever I go and address them that we are not ashamed of having diarrhea, fever, or cold and cough. So, why should we be ashamed? Where is the harm? Where do we stop? When we are not feeling good mentally, why can't we speak out and seek help? If we come across somebody suffering from mental health issues which is yet to be addressed, we must try our best to help that person. We have to be more accepting, compassionate, and empathetic towards other fellow human beings without invading their personal space. This is very, very important. It is important to gain the trust of the intended person, give unconditional positive regard to him or her, try to convince when things are not right, and motivate to seek professional help. So, let us all join our hands together to raise awareness about mental health as it is the need of the hour. Mental health shall no longer remain a taboo. Thank you.
Thank you. Thank you very much, madam. Thank you. Actually, for a long time, we will remember that mental illness must not be branded as madness or craziness. That is very important. That's what you have told. And because we are running short of time, so I think we should take one or two questions. I will agree with our Pro-Chancellor, sir, that whatever West Bengal University has taken in the steps in ensuring mental health in their students, because now our university has also become a multicultural university ecosystem, because we have got students from more than 30 different countries in addition to a lot of domestic students. So it is time, I think we should also put a system of how to ensure mental health, and there should be periodic psychological counseling in our hostels also. So I think because at that time our Pro-Chancellor could not speak, probably due to connectivity problem, I'll request sir to speak few words. There is some problem probably.
Okay, am I audible now?
Now you are audible. Yes, sir.
So, I think it was one of the most fascinating orations we have heard in recent times.
Yes,
And as you can see, when she was talking about the ecosystem, we have got ecos in the whole system now. So, Madam, our heartfelt thanks to you for sparing your valuable time. And Professor Nachieketa, since we have recently started the master's course in clinical psychology, we'll request Madam to, join us as a visiting professor and, and share her experiences and share her knowledge and wisdom with our students.
sure, sir.
I'm sorry about this network problem, so I think I've closed my mic now. Is it okay now?
It is okay, sir.
Okay. And thank you once again.
Sir, thank you. Thank you, madam.
Thank you.
Any one questions we will like to take from the audience? If anybody has any question, you can ask. Anybody? If there are no questions, actually I personally has a lot of questions. Now, Joy Thomas has raised his hand. Yes, you can. Joy Thomas, you can ask your question. You can introduce yourself and ask your question, please.
Okay, thank you, sir. My name is Joe Thomas. I'm an international student from South Sudan, Africa.
Yes, tell me.
This is my
Yes,
first
please ask
Saturday
your
in
question.
Okay. Okay, now, like the social life, the food, and in India, it's not favorable for us. So the food we eat back home, it's quite different from here. Here it's so spicy, and then when we eat it, it affects us. When it affects us, we start thinking about home. The mind is disturbed. Okay, so at times we don't be so in our convenient time, or one doesn't be comfortable. So that disturbs us a lot, and no one is there to look at that, or no one is there to talk to us, so that the mind can come back to its better state. And then when it comes to the social life, when we move around, people see us like as if we don't exist. They see us like in the life of the monkey. So it disturbs us also sometimes. So thank you.
Okay.
It is so nice of you that you have spoken out about your problems, and you have your mentors, you have your senior teachers. I'm sure that this matter will be taken into consideration. Your problem shall be addressed.
Yes.
I can speak on the behalf of your faculties, your administrators, and it's very nice of you that you have spoken out. The first thing in this mental health issues is that if you are not feeling that things are okay, please speak out. And definitely that is the first step for solution. If you do not put a problem statement, never a solution will come. That is what I was telling, that because people are coming from different various cultures and all, so food habit also varies, and the language problem is there. So many issues are there, and ultimately under all circumstances, one thing is very important: the environment is not going to change for you. You have to adapt yourself according to the environment, because the happiness is there within you, and you have to find happiness for yourself. Others are not really going to take much effort to make you happy. That is how we have to train our minds and accept things to the maximum, adapt to the new situations, new environment, and also definitely others are there to help you out, and things will be fine very soon. Thank you, Joy.
Thank you, madam. Joy Thomas, be rest assured that we will solve your problems definitely, because we are going to address your problem very soon. Okay. And
Okay, sir. Thank you.
and we have got two, madam. I will request you to take two questions. In the audience, there is the former ambassador of Uganda to India, Madam Dina Akelo. She has one question. So, madam, you can ask your question.
Hello, I hope you can hear me.
Good evening.
Yes. Good afternoon, ma'am. Now, first of all, I would like to thank you because you started your discussion by saying you are going to talk like a mother and a teacher at the same time. And I thought
Yes.
this question then, I like that very, very much, because in the situation of universities, especially international universities, you have young people such as the one who has just spoken now. Time was when we had orientation programs. If a student came as a government student, sponsored by the government of, say, Uganda or the government of Sudan and supported by the government of India, they would have had an orientation at home. The Ministry of External Affairs would have taken them and told them, if you are going to India, this is the culture, this is the way people dress, this is the way people eat, this is the way. But nowadays, because of this connectivity, a student may just find that he wants to come to your university because he feels it's a very attractive university. So there is no orientation for the person, there's no guidelines, there's nothing. He arrives in India and he expects things to be like they were in Uganda. And of course, it's a completely different environment. And also, and this is not a criticism of your ecosystem in the universities, also, you may not have an orientation program for international students. So when people come from, or you might have it at a broader level, international students. So therefore, you orient the Americans, you orient the Mexicans, you orient the Japanese, you orient, but you don't have specific programs say for Africans, orientation for Africans, which could be one thing that you could have. And this would help young people like those. I don't know if you have taken too much, but thank you very much. This was a very, very interesting orientation. I want to congratulate you and the university for it. Thank you.
Thank you, ma'am. Actually, we in our university, we are not having foreign nationals, but this time, for the first time, we have given a mental health advisory. And when first year students are coming in any discipline, we are having an orientation program. We are having a screening for the test if anybody has overt mental health issues because they are undiagnosed or they are neglected when they come to college and universities, and even parents, they are hiding the fact. We recently, 2-3 months back, we lost a very brilliant student of ours, and after she committed suicide, then parents are saying only 3 days back she had gone home for her checkup with a psychiatrist and had change of medications. So sometimes parents, they are not communicating with the universities, they are hiding because of some sort of stigma. This is some harshest thing is there. Because if we are informed that a person is having some sort of health issues, then we can take special care of that person. So we are also trying to talk to the parents. In the orientation program, we are bringing in the parents, like in the first interaction of the administrator as the principal. In before my charges as the vice chancellor, I was principal or dean of a medical college, and I made it very, very particularly, I made talks to the parents. And I told them that how they can take care of their children and how they should help them to live a happy and healthy life. So this, I very well said, ma'am, orientation programs, screening programs, and initial, it has been seen the first year is the most vulnerable stage. If they, for first 1 or 2 years, they are having their toddlers, they are having teething problems, and they are having so many issues. If they overcome the first or second year of their university curriculum, then they will do fine. That is what we have noticed. Thank you, ma'am.
Thank you, madam. Thank you for the nice questions and very beautifully explained by Madam Vice Chancellor. So I think we should end the program here. So on behalf of the outreach cell and the university, we are extremely thankful to you, madam, for the brilliant oration that you have given.